Welcome to the first in our series of demonstration videos for how to use the new SUI Surgery Module of AQUIRE. If you are not a registered AQUIRE user, please visit www.augs.org/acquire, AQUIRE, to sign up. Once you have completed the sign-up process, log into your AQUIRE account and click on the SUI portal link on the left-hand side, then SUI underneath that in order to access the SUI module. You do not have to enter patients into the QCDR module or use the MIP system in order to participate in the SUI module. To add a new patient, I'll click the Add New Patient button in the lower right-hand corner and enter the patient's information into the boxes. Please note that boxes with a red asterisk are required fields, including the patient name, email address, and date of birth. Let's call this patient Ms. Sarah Test. For the date of birth field, I can enter free text, as shown here, or I can choose from a calendar by clicking through these options. However, if I try to enter a patient whose current age is less than 18, the system will generate an error. Only patients over the age of 18 should be entered into the registry. When I'm finished with that, I can enter as much of her race, ethnicity, and address information as I would like. And then when I'm done, I'll click the Proceed to Visit Information button. You'll see a new patient has successfully been added to the registry. The first visit type we'll enter is the consulting visit. As you'll see, this is the visit where I enter demographics, medical history, diagnosis, and so forth. This can be completed at an initial visit when the patient decides to have surgery or when I'm filling in the information about the surgery itself. The first thing that I'll do is choose a date for this visit. Let's say that Ms. Test came to see us back in June sometime. From there, her age auto-populates and a subsequent series of questions opens up. Now I'll complete her demographics. Ms. Test is 5'4" and weighs 125 pounds. The system then automatically calculates her BMI from that information. We've deliberately kept the medical history questions to an absolute minimum. In the last month, has she been using vaginal estrogen? My choices are yes, no, or if the patient is premenopausal, you can select not applicable. Does the patient currently smoke? Let's say she doesn't. When it comes to diagnosis, selecting mixed urinary incontinence opens one subsequent question. Is the patient currently taking medication for overactive bladder? Now I'll move on to a series of diagnostic and testing questions. You'll see that all of these are yes/no questions. I'm never asked to provide the results of the test, just whether or not it was performed. I'll answer these questions about testing. Was a urinalysis performed? Let's say yes. A physical exam? Yes, we did that. And a cough stress test, but maybe we skipped urodynamics and post-void residual volume. In this case, the patient has not been diagnosed simultaneously with pelvic organ prolapse. When we get to the question about existing urogynecologic mesh, answering in the affirmative does open one subsequent question where I can choose existing mesh for SUI or existing mesh for other urogynecologic condition or both as required. Let's change this back to no. And let's say that the patient has in fact tried conservative therapy for SUI at some point in the past. Now on to the last section, the ICIQ, International Consultation on Incontinence Questionnaire. This is 4 questions long, and if possible, we recommend that you give this to your patients to complete, either as a paper form or just ask her to click through the responses here. A printable copy is available on the SUI Surgery Module website. If you are not able to have the patient complete the form herself, please ask her these 4 questions, making sure that she understands, as indicated here, the questions apply to the past 4 weeks. Let's now answer these questions as if we were the patient. How often do I, the patient, leak urine? Maybe once a day. How often do I, the patient, or how much urine do I, the patient, thinks leaks at that time? Maybe a moderate amount. And I'll say that this bothers me relatively a lot, a 7 on a scale from 1 to 10. The last question opens a drop-down box where the patient can select as many options as are needed in order to adequately describe her condition. Once I'm done there, I'll just click Save and Close, and that's the whole consulting visit. We'll now see a new consulting visit added to the visit list for this particular patient. If I wanted to edit this information, I would click on the blue hospital next to this visit. I can return to this visit at any time to update the information. The consulting visit never closes. In our next video, we'll enter a surgery visit for this same patient, including her device information. Thank you for watching the SUI Surgery Module demonstration video.